For anyone watching, this is a recording that I'm saying the Mike Gravel's email. So anyone that sees this is, if it sounds like I'm talking directly to him, it's because I am. Mr. Gravel, I saw your video. I'm not really great on typing, so I'd rather talk face to face with someone. I just woke up, so that's where I look at this. Healthcare. My personal belief is that each state should decide on its own what they need for themselves. The people of Hawaii have made a decision. It's a good start. We need to go forward with it, do a little bit more changes to it, but it's working basically well. I know that some of you guys are really unhappy with the systems that you have or don't have, which is even worse. But if we're going to have to do it on a national basis, then it should be set up like a branch of the service. Pay should be set up like the branch of a service. That means you get the same pay as, as a colonel or a general or a petty officer or a sergeant or a recruit. Take all the medical branches for all the services and combine them under the Department of Health. That doesn't mean that they're absolved from military service. That just means that they are now under the Department of Health instead of the Department of the Navy or the Department of the Army. They get rankings in the same manner as they would in the military service. We set up commands and posts in each of the states. That means hospitals, clinics. From there, we also have to go to the schools for scholarships and such. They get the same deal as an officer's corps would get in the military. So much schooling for so much service. They wouldn't be making big bucks. They'd be making the same kind of money that the military's making. So you ain't going to get rich doing this. But you will get the training that you need, and we'll get some doctors, nurses, orderlies, medics, corpsmen. They will still be serving with the service. They will still be serving with the military when needed. They will still be under the command of the federal government, so that when there is an emergency someplace in the United States, they're going. There's none of this, well, I didn't volunteer for this. Yes, you did. Just as soon as you signed those papers, took the scholarship or whatever, you signed the papers, you're going to that disaster area to help the people out. That's it. How are we going to pay for all this? Well, for one thing, since we separated them out of the military, there's a portion of funding there. Since they are now in the public sector, no, this is not going to be free. When you go to the hospital, you're going to have to pay something. I don't care if you have to pay $20 to get a doctor's visit. You're going to have to pay something. This ain't free. Now, our taxes are already high enough. If they get any higher, people aren't going to be able to afford to buy their own food. But if insurance rates go to $1,000 a month, you're going to break people. And if you tell the insurance companies that everyone's got to have health insurance or they're in trouble, then the insurance companies will do the same thing they did with no-fault auto insurance. They'll say, hey, we got ya. Either you pay what we ask or we don't give you insurance and now you're in violation. Take the fine, go to jail. Let's not do that. Those people who want to keep health insurance for themselves, go to Civilian hospitals, fine. You want to give them a voucher for that? Fine. Uh, but if you really want a national health insurance, that's the way you're going to have to go. It's going to have to be government hospitals, government workers, and these government workers are going to have to be set up in a military-style service. Otherwise, your problems with unions, lawyers, insurance companies, and everything else that goes into the mix is going to make this so costly they'll just about bankrupt us. Think about that. Get back to me. Tell me what you got to say. Let's have a discussion on this, Mr. Gravel.